Hello, today I would like to welcome Miss Katy Reed. She is a program director of sports science in Exeter College, United Kingdom. She is one of the dynamic and talented football coaches also. So it is my privilege to welcome you, ma'am, for this historic event, and all the participants will learn a lot from your lecture. Over to you, ma'am.
Hello and welcome to my presentation for female footballers, common injuries and how to deal with them. My name is Katy Reed. I'm a sports therapist and a lecturer. I'm really delighted. It's a great pleasure to be invited to take part in this virtual conference for women's health and physical health in 2021. And I hope that you enjoy my presentation and hope that you can get something from it. So just to give you a little bit of a background about myself, so you know my career path. In 2008, I graduated with my degree in sports therapy from University College Birmingham in England. And once I graduated, I immediately went into employment with Exeter College as a part-time lecturer and women's football coach. And during that time, I was working at the University of Plymouth as a sports therapist, running my own private practice, mainly for university gym users and for university sports players. And then for 1 year, I went to Solihull College in Birmingham as a part-time lecturer, and I was employed as the sports therapist for Birmingham City Ladies Academy team. And then I came back to Exeter College and became the programme manager for the foundation degree and the Bachelor of Science degree in sports therapy. And I am still the coach for the women's football programme. The women's football programme at the Exeter College started off at a very low level when I first started. And we eventually have built the academy up, and the ladies are now playing at a elite level, and they play at the most competitive level that they can in England at college level. And then in 2018, I graduated with my master's degree in professional studies and tailored my research towards ankle injuries, which is the main topic that I'm going to talk to you about today. So just to give you a background in terms of the kind of standard of football players that I've worked with, and these aren't necessarily ones that have had injuries. So I picked out these three because they're the most obvious ones that I can think of. So at the top, we've got Bo Jackson, who played through our Exeter College Women's Football Academy and now plays at a very high standard at Plymouth Argyle Ladies Football Club. On the right-hand side there is Sophie Bagley, who's a goalkeeper, who she plays now for Bristol Academy, who are an elite team, and she came through the Birmingham City Ladies Academy when I was at Solihull College. And at the bottom there, we've got Georgie Barber Gresham, who only last season came through the college sports academy, the football academy there. And she has gone on to play at semi-professional level. But during her time at college, she was selected as the England Colleges captain. So made it into a really high standard and played some really competitive games as well. So in terms of injuries, at the college, we run a clinic on a weekly basis, 2 or 3 sessions a week. And the majority of players that come into the clinic are sports academy students. And one of the things that I noticed was that we had a lot of footballers, female footballers, that would come in with lateral ankle sprain injuries. And it became so common, and it was one of the areas that I was very interested in. But one of the common patterns that I noticed, they'd be coming in for clinic, we'd rehabilitate them back to play. They'd play for a few weeks, and then they'd start to develop these medial ankle problems. And for me, that was something then later developed into my master's, which I'll go on to talk to you about in a minute. So just in terms of kind of gender considerations, there's lots of theories around kind of gender and to consider the differences between female and male footballers. But actually, there's so many debating research out there that talks about gender, and nobody has really kind of justified and concluded that there is indefinitely a difference. And actually, I think it's really important that we consider that the type of injury and how the injury occurs is dependent on the sport itself. And so we've noticed over the years that specific injury patterns have been noticed across specific different sports. So interesting to note, in 2015, a study by Ajay et al. Looked at a variety of sports, and they came up with, they found out that the most common area for injury was the ankle joint at 26.5%. And that's across males and females. Again, not really kind of having to consider the gender. So just to have a look at the gender in terms of footballers or soccer players, okay, female footballers by Kerr et al. In 2015 were found to have 8.4 injuries per 1,000 hours of training and competition, and male footballers were found to have only 8 per 1,000 hours, which, in my opinion, is really not that big a difference. 8.4 or 8 injuries per 1,000 hours. It is a very similar figure. And again, so, you've got to question, can you consider the gender differences here or not? So in a more recent study by Pujars et al., again, they looked at lots of different sports and different injuries that occurred from those sports. And they actually found that there was no significant findings between gender. But interestingly, the common area for injuries was in the lower limb, again, relating to that ankle joint. So research in 2010 by Colvin and Lynn had again looked at lots of different sports, and they found that in football or soccer, females were more likely to gain an injury to the ankle and the knee. Again, kind of justifying what I had seen in the clinic over the years in terms of female footballers coming in with ankle injuries. And then the most interesting thing there was that they found that it was females were more likely to have reoccurring injury, and most commonly in the ankle. But they didn't note specifically whether it was exactly the same injury or whether it's a developing kind of injury in the ankle. And again, that kind of links back with my theory of a development into potential medial ankle pain after the lateral ankle sprain. And then they also found, I thought this was interesting to note, that in volleyball players, female players were more prone to knee injury, and particularly in the patellar tendon overuse. And again, just kind of showing that difference in sport and the specific types of injury for the sport, but not necessarily a massive significant difference across genders. So some really interesting articles and there for you to perhaps have a look at if you wanted to in your own time. So just to talk to you a little bit about anatomy, we'll start with the lateral ankle. So on the top right hand side corner here, we have the ligaments of the ankle. So here we have the ATFL ligament, which is the most anterior ligament of the three on the lateral side. We then have this calcaneofibular ligament, and then we have the posterior talofibular ligament. The attachment sites for these ligaments are in the name of them. Okay, so anterior towards the front, talofibula, so it goes from the talus bone across to the fibula. Okay, and the same down here, we've got the calcaneofibula, so it goes from the calcaneus up to the fibula, and the posterior, we know posterior means towards the back, goes from the back of the talus, you can just see it peeking out there, okay, and comes across to the fibula, so talofibula. So that's your three main lateral ligaments. The most common ligament to be injured here is your anterior talofibular ligament, closely followed by your calcaneofibular ligament. And the PTFL is, there's not many injuries to that ligament because it's a completely different mechanism to be able to have that injury. So if we look at the other soft tissue structures, or some of the common soft tissue structures around that area, this picture is not too great to demonstrate those muscles, but I wanted to get a picture to show you the perineal, or the fibularis longus, and perineal or fibularis brevis. So you have these two muscles that run down the outside of the lateral side of the leg, in line with that fibula, that act upon that lateral side of the ankle. So the perineal longus runs down, and then it comes down around underneath the foot, onto the base underneath the base of the fifth, and then the peroneal brevis, a little bit shorter, runs down and attaches onto that base of fifth. Around there, so that those two muscles kind of act upon that lateral ankle complex. So if we do damage our lateral ankle ligaments, it is very likely that our peroneals are going to play a part in that pain and problem. So if we have a look at the medial ankle then, which is a little bit more significant on the back of that kind of lateral ankle problem. So we start with the ligaments. We have what we call the deltoid ligament, okay, and that is made up of 4 parts. And again, if we break the names down the ligaments, they kind of make sense, which is nice. So we have the anterior tibio-talar to start with. So this goes from its anterior part of the ankle joint, okay, and it goes from your tibia, which is this bone here, through to your talus. Okay, and then if we have a look at the next bit, we have the tibio-navicular part. So it goes from your navicular bone to your tibia and comes down like that. And then we have your tibio-calcaneal part, which runs from your tibia to your calcaneus. And then the final 4th part of that deltoid ligament is the posterior tibio-talar. So again, goes from your tibia to your talus bone. Okay, and then we also have this ligament that sits across here called your plantar calcaneonavicular. So it goes from your calcaneus to your navicular. So these all play a significant part in that medial ankle complex. Okay, but these ligaments, the deltoid ligament, is actually more strong than the lateral ligament. So it is more likely for our lateral ankle to become damaged. But also one consideration is if we look at the bony structure over here on the left-hand side, that your fibula is lower than your tibia as it runs down and creates those medial malleolus. So naturally, your ankle is going to have more inversion and naturally it is going to roll that way. However, our stronger ligaments are on the medial side. So if we look at the other tissue around this medial side here, then in kind of the antagonist or opposite to the peroneal muscles, we have our tibialis posterior tendon and our flexor tendons that come down here. But the one I want to pick out is this tibialis posterior. So it runs down here deep underneath the flexors on the medial side. And I've just highlighted this with yellow here, where the tendon runs. So it comes down, it goes around the back of the medial malleolus and then tucks under the foot and inserts to all the 5 tarsal bones and to the base of the 2nd to the 4th metatarsal. Now, a lot of muscles tend to have an action, but this muscle in particular also has a function, and its function is to support the medial arch. So if we have a drop in our medial arch, then it is likely to be because of tibialis posterior, and we tend to call that a tibialis posterior syndrome. Now, my kind of theory was that if we have a lateral ankle sprain and it rotates to inversion, and then we kind of try to rehabilitate it, those ligaments are not strong enough to hold it, and then we get a contrasting movement and mechanical issue where our medial arch then will start to drop and we start to develop this tibialis posterior syndrome. So hopefully that gives you a bit of an overview of the ligaments and the soft tissue around the medial and lateral ankle to get an idea of where I'm going with this. So my master's research, just to give you a little bit of background before I carry on kind of talking through and getting you to think about some elements. So I looked at the relationship between navicular drop, which is on the medial side, in comparison to chronic ankle instability. And I looked at anthropometrical measurements as well to look at some kind of further relationships and functional movement in football players. And because of what I talked about in terms of gender differences, originally I was thinking about just doing female footballers, but decided that there really isn't that much significant research out there to debate about comparing or just picking out female footballers. So I went with both female and male footballers. So I had a look at the different variables here. So to start with, the first relationship that we looked at was the navicular drop test and the Katy scores. So the Katy was the chronic ankle instability tool, and navicular drop is the picture that you can see here on the right-hand side. So we measured how much the navicular dropped and then had a look to see if there was a relationship between a drop in the medial arch and if they had had a history of ankle sprain and therefore have instability. Okay, and then the second relationship we looked at was 3 different relationships, which was again the navicular drop test and the Katy scores, but also bringing in the anthropometrical measurement and to see if there was a relationship between the 3 of them. And the final one that was tested was again navicular drop test and the Katy scores. And also then the Y balance test. And the Y balance test is a stability test that is done in the shape of a Y. And if you're not aware of it, perhaps it's something that you could investigate after this. So the results of my study, I've highlighted it in yellow over on the left-hand side, is that there was actually a significant negative correlation between the navicular drop test and the Katy scores, suggesting that there is some relationship between lateral ankle sprain and a medial drop, okay? But the results only kind of showed significance in the left foot. But that is kind of something to look at, whether that was commonly the dominant foot or the non-dominant foot, and whether if it was the non-dominant foot, was it because there was a weakness there, because they're not their strongest foot, or and so on from there. So lots of kind of discussion points to develop from that. There was no other significant correlations between the rest of them, although a lot of them were approaching significance, but there was nothing kind of significant to pick up from it. So from the study, it is recommended that these variables are looked into and analysed further to kind of identify different relationships, or these relationships in different populations with different kind of inclusion criteria and exclusion criteria. So it could be that we take the approach of looking at females and then looking at males, looking at dominant foot or non-dominant foot, and so on, to see if that kind of affects the results there as well. So what now? Okay, so for me, I still have a keen interest in women's football and the common injuries that occur, and obviously I'm working with them on a daily basis, so for me that's kind of where I want to go, and I will keep looking into research and looking into that relationship between lateral ankle sprain and medial ankle problems, and it's something that I'm always going to be interested in. I personally have experienced it. I used to play football when I was younger, and I personally have experienced it where I've had a lateral ankle sprain, and a year or 2 down the line I had that medial ankle pain, and so it's probably something that actually stopped me from playing. So this research down here by Bubra et al. And Errol et al., they've talked about tibialis posterior dysfunction, and they have said that there's many contributing factors to predispose an athlete to tibialis posterior dysfunction. And one of them is indefinitely previous foot or ankle trauma. And that kind of brings in that link between the lateral ankle sprain and the history of injury there into that medial ankle problem. And I think that kind of almost clarifies my link in my research as well. So for me, I wanted to kind of just highlight that research that I did, and just wanted to get you thinking about the common injuries in women's football. And actually, from my experience, the common injuries are lateral ankle sprains later developing into medial ankle problems, specifically tibialis posterior syndrome. And how to deal with them, that was the question I put at the beginning, common injuries and how to deal with them. Well, I think the simple answer here is that we need to do much, much more research to be able to determine whether this chronic ankle instability is affecting medial ankle pain in female footballers. And if it is, then to tackle that medial ankle problems that we tend to get in female footballers is to actually tackle the lateral ankle problems. So after this, I hope that you can have some consideration into lateral ankle sprains and medial ankle problems, specifically tibialis posterior syndrome. And I hope that you can apply that into your practice and do have a little look around at the research that's available. I'm more than happy for you to contact me if you have any further questions, and I will also be sending the PowerPoint slides across so that you have an electronic copy for your interest as well, and have a little look back through the slides. Again, thank you very much. I hope that you've enjoyed the session, and I hope that you enjoy the rest of the conference, and many thanks for your time.